And what are your thoughts on HR3?
What is it? I don't know what is HR3.
I don't have clarification on that.
All right.
If
that's
I
fine.
could,
Thoughts?
we'll
I don't
just
know what
stand
it
by.
is.
Yeah. I'll chime in when I get an answer here. Oh wait, here it was Pelosi's Medicare price negotiation bill.
Oh, wow. You know, I don't know that I know enough about it to say.
You just want to explain just very quickly Medicare, the idea of Medicare negotiation for anybody who doesn't know.
Yeah, I mean, the issue, I think one of the big issues with Medicare is that under the Bush administration, the government basically removed its ability to negotiate prices in Medicare, which is nuts. Like, why wouldn't you negotiate prices? I mean, that's how
Which most of virtually every other developed country does.
Right. I mean, it was just a pure gift to the pharmaceutical industry. And, you know, because of that, we've had runaway pricing year after year after year. So I don't know the details of HR3, but I know that that is something that, you know, everybody keeps coming back to as a massive problem for our drug pricing policy.
Great. We do have a question comment here.
Mhm.
Hi, this was a really excellent talk. I'm a student at the University of Toronto taking a course on health and pharma, and many of my classmates read your book. What would you say to young people who have read your book and want to take action?
Oh, this is a great question. And I've gotten a lot of these, questions about how do we take action. I wish I had a better answer. The problem has been that the usual consumer organizations have viewed any discussion about generic drug quality with suspicion. They think it's a kind of stalking horse for a big pharma agenda. And they have been mostly activist on the question of cost and access, right? But of course, the problem that the book exposes is a low-cost drug is not a good deal if it doesn't work. So that's been part of the stumbling block in getting really a consumer revolution going. That's what is needed, is a consumer revolution. Now, that said, there is a growing awareness about this issue on Capitol Hill. You know, elected officials have become more responsive. There are efforts underway by certain groups to create a kind of accreditation system for generic drug companies, you know, to kind of a good housekeeping seal of approval. So there are, you know, efforts underway, but there's no kind of one clearinghouse right now for activism on this. So,
but let me just ask, if the FDA can't inspect these things and guarantee, why would some seal of approval organization be able to, which doesn't have the resources of the FDA, be able to do it? I mean, it really makes you wonder. It's
right. Well, the idea would be that, you know, because of the growing awareness that all these drugs are not the same and some of them are really low quality, generic drug companies that wanted to distinguish themselves from the crowd would open themselves to further audit, further review, maybe testing of their drugs, and thereby get some sort of distinguishing accreditation from an outside monitoring group.
But you would have to, I mean, if they don't do that for the FDA, what would it matter if it's some outside monitoring group that doesn't have the expertise, or that? I'm just asking.
Right. Well, of course, now you've put your finger right on the entire quality crisis of our drug supply, which is everybody assumes if the FDA says it's okay, it's okay. And we know that that's not true. So the question is, could you build in some further quality assessments? You know, like there's a pharmacy in Connecticut. It has a new disruptive model, which is that it tests every batch of drugs that it dispenses. So, you know, it is basically acknowledged FDA approval is not enough. We've got to test as well.
So they actually chemically test.
Yeah, and this little pharmacy in Connecticut is the one that figured out that there were all these carcinogens in Zantac. And they filed a citizen petition with the FDA to get it pulled from the market.
Now that still isn't the issue of efficacy or even safety. I mean, but it's looking for bad things, bad chemicals. Basically.
Right, but the fact of the matter is there are carcinogens in FDA-approved drugs. We've figured this out with the valsartan and losartan, these blood pressure medications, which have been found to contain carcinogens, and they've been recalled from the market. You know, that's been a huge scandal in our own drug supply. And by the way, the active ingredient that contained these carcinogens came from India and China. So there you go.
Yep.
We have another question lined up here. Other than COVID-related medicines, what other kinds of medicines are the most likely to be substandard, counterfeit, or otherwise high risk from a quality perspective? And they clarify drugs such as cancer drugs, diabetes drugs, cholesterol medicine.
You know, there was no particular class of drugs. It was really across the board. The one issue in particular was any slightly more complex drugs like time release drugs, and the generic drug companies have to invent their own time release mechanisms because those are all separately patented. And so, you know, wherever you had any slightly complex drug, those were found to have serious problems. But also, you know, drugs that require precise dosing. They're called narrow therapeutics index drugs, like cardiology drugs, endocrinology drugs, neurology drugs, where slight variations can even mean the difference between life and death. In the book, I write about immunosuppressants for heart transplant patients, and patients who have gotten organ transplants have to take that their entire lives. And it was found at the Cleveland Clinic that heart transplant patients were suffering organ rejection when they were switched to a generic immunosuppressant that was made in India. So it's across the board.
I must say, journalistically, it sounds like there are about 5 years worth of stories in just the things you talked about today.
Yeah. Yeah, it's a lot. I mean, it's a lot to wrap your mind around for sure. And it's a big global canvas. So just from a reporting point of view, it was extremely challenging to try to connect all these dots across the world, which is probably why the book took me so long.
Again, I highly recommend it. And I see some people who have read it feel the same way.
Speaking of how long it takes to write a book, someone's asked, what is your next book?
You know, I'm reporting sort of around the clock on COVID-19 for Vanity Fair. And some people have said to me, oh, well, you know, you should do a book about COVID-19. And my thought is, God, does anybody right now want to read a book about COVID-19? You know, after like a scary day in quarantine, do you want to unwind at night?
Well, I seem to be able to sell books about the Trump administration. That seems to be a bestseller.
So I don't know. I don't know if it's a book about COVID-19 or something else. I'm not sure.
Okay.
Well, this seems like a good point to wrap up. Thank you so much, Katherine and Dan. It was a very fascinating and extremely alarming conversation. But your reporting is incredible, and we hope the FDA tries to do its job better.
Thank you so much. And thank you, Dan, and thanks, Patricia, and to the Overseas Press Club. It's really an honor to participate in this forum. I just want to thank you.
And I'm doing it in quarantine, so.
Oh, there you go. Or you're on lockdown there?
There you go, yes. So. But we'll all survive, so.
Let's hope.
All right.
Yep.
Thank you.
Okay.
everyone.
Okay. Thanks so much, everybody. Thanks
Thank
for
you,
joining us.
everybody.
Okay. Bye-bye.